There are several muscles that move the arm at the glenohumeral joint, and these muscles include the biceps brachii as well as the triceps brachii, which both cross at the glenohumeral joint and the elbow joint. So these muscles are capable of moving both the arm as well as the forearm. So these muscles, which are attached to the scapula, are sometimes referred to as scapular muscles. They include the deltoid, the coracobrachialis, the teres major, and a group of muscles called the rotator cuff muscles. These would be the subscapularis, supraspinatus, infraspinatus, and teres minor. So let's look first at the rotator cuff muscles. And a good way to remember these are based on the scapular spine, which is part of the appendicular skeleton that you've already seen. When we look at the posterior view, we can see the scapular spine shown right here, a bone marking, which is on the scapula. The muscle which is directly superior to it is called the supraspinatus. The muscle directly inferior to it would be the infraspinatus muscle, and then also the teres minor muscle. Then when we flip the scapula over to look at an anterior view of it, the fourth muscle in the rotator cuff group would be the subscapularis muscle. So a way to remember these muscles is to remember that they are the sits muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. Functions of some of the muscles that move the arm at the glenohumeral joint are shown on this particular chart. We first begin with the latissimus dorsi. It's a very large muscle, and it's an agonist of arm extension. Remember, that means it's the prime mover of it. It also adducts the arm and medially rotates it. In fact, it's often referred to as the swimmer's muscle. So if you imagine a swimmer doing the breaststroke and then bringing their arms out of the water and taking that, putting their hands back in the water, that would be due to the latissimus dorsi. The next muscle is called the pectoralis major, which is responsible for arm flexion, as well as adduction of the arm and also medially rotating the arm. And again, you don't need to worry about the specific attachments. Other muscles that move the arm at the glenohumeral joint would be the deltoid. And a part of it, the deltoid is a huge muscle. So based on which fibers, where the fibers are anatomically located at, they could either flex the arm, could be an agonist of arm abduction, so to pull the arm away from the body, or to extend the arm and laterally rotate the arm. The teres major, which, remember, it's important for you to know that this is not a rotator cuff muscle, because the teres muscle, which is part of the rotator cuff, is the teres minor, and you should be able to identify those. It extends the arm and also adducts the arm and medially rotates the arm. The triceps brachii, located on the posterior side of the upper arm, is going to extend the arm at the elbow joint, adduct the arm, so therefore it's the prime extensor of the elbow joint. Other muscles located in the same vicinity include the biceps brachii, which is going to flex the arm at the elbow joint, the rotator cuff muscles, which we've already seen. Collectively, these four muscles are going to stabilize the muscles at the glenohumeral joint. And again, they include the subscapularis, the supraspinatus, infraspinatus, and teres minor muscle. So the sits muscles, the subscapularis will medially rotate the arm. The supraspinatus abducts the arm. The infraspinatus laterally rotates the arm, as well as the teres minor. Looking at the forearm muscles and the muscles in the antebrachial region, the anterior compartment is going to contain a group of elbow flexors. The flexors tend to be on the anterior compartment, and the extensors are on the posterior compartment. The elbow flexors would include the biceps brachii, brachialis, and brachioradialis, and the posterior compartment would include the triceps brachii, which is an elbow extensor. And again, the elbow flexors are going to be in the anterior compartment. Looking at this diagram here, we can see a diagram on the left and a cadaver image on the right of your slide. We can see the deltoid, pectoralis major, biceps brachii, triceps brachii, brachialis, and brachioradialis. It's not important that you know the difference between the long head and the short head of the biceps brachii. Looking at the posterior muscles that move the forearm as well, we see the deltoid, infraspinatus, supraspinatus, which remember are rotator cuff muscles, teres minor, a rotator cuff muscle. The teres major is not a rotator cuff muscle. Triceps brachii, latissimus dorsi. And again, just like with the biceps brachii, you don't need to know the lateral and long heads for the triceps brachii in this case. So those muscles that move the forearm are shown on this table. The flexors, again, are in the anterior compartment. So when you're standing in correct anatomical position, those muscles are going to be on the anterior surface. The biceps brachii flexes the forearm, also supinates the forearm when the elbow is flexed, which makes it an agonist. The brachialis is also an agonist of forearm flexion, as well as the brachioradialis. It's going to flex the forearm. So maybe a good suggestion would be to just group some of these muscles that have the same function together on a note card. Muscles that are on the opposite surface of the body would be the extensors on the posterior arm. And so that would include the triceps brachii, which is the primary extensor of the forearm. And it's going to extend the arm as well as adduct the arm.